My name is Richard Danko. I'm 57 years old and I'm from McKinney, Texas. I played sports in high school. I joined the Army at 18. I spent a little over 21 years in the Army. I did various things in the Army. I've jumped out of planes. I did multiple patrols, multiple deployments in the Army, the last one being Iraq in 2003. After retiring from the Army, I joined the Allen Police Department, first as a dispatcher and then as a patrol officer. I've worked in numerous positions within the police department. And I also was on the SWAT team for a few years. The thing I like about my job is being able to help people. People call the police often when they have no place else to turn to, and it's very fulfilling helping them get their needs met. The pain manifested itself gradually. It started just not being able to move, not being able to stretch out. I was unable to do exercises. I was also struggling with putting my shoes on. Getting into my truck was an issue. Just lifting my knee up toward my chest area created a lot of discomfort. One of the things that I was also limited to was my ability to run. Obviously, as a police officer, that's an integral component of what we are able to do.
Richard's x-rays showed bone-on-bone arthritis. Basically, it means that all of the cartilage in his hip joint had deteriorated and the bone was grinding on bone. When I first talked to Richard, my goal was to convince him to get one hip done, the worst hip. But Richard talked me into getting both hips replaced at the same time. In select patients who are both healthy and motivated, both or bilateral joint replacement is a great option. Richard's surgery went extremely well. We were able to accomplish both or bilateral hip replacement within 3 hours.
Right after surgery, I didn't have pain. I haven't had pain since, and matter of fact, I was walking a couple hours after the surgery. I would highly recommend the joint program at Texas Health Allen. They were consummate professionals. From the minute I got there, they in-processed me. An hour later, I was going down the surgery. Post-surgery, the folks there were spot on with regard to any questions or needs I may have had.
I'm Moraya Moraguri, the Orthopedic and Spine Program Coordinator at Texas Health Allen. The work I do helps with patient outcomes by bridging the knowledge gap for the patient and their support system. We achieve this by helping them with their medical equipment that they need for postoperative recovery and care, setting them up with home health or any resources that they need to recover back at home, and also bridging that knowledge gap and explaining the process of recovery and the connection between the hospital and the physician's office and all that they need to get better.
Richard is a new man. With 2 new hips, I think he has a new lease on life.
I can put shoes on again, I can get in and out of my truck. I started running about 4 days ago. Thanks to the surgery, I don't see myself being limited in doing anything that I want to do.